So just a quick bit of background for myself. So I qualified as a doctor in 2003 and went into GP training, and then I joined Library House Surgery as a GP partner in October 2008. So I've been a full-time GP partner now for 11.5 years, and I am also now working in mental health coaching. So just to put you in the picture, I'm sure you've got a sort of a rough idea of this anyway, but a standard GP consultation is a 10-minute consultation, and normally we see between 30 and 40 patients every day. So a morning clinic would be 16 to 18 patients at 10-minute intervals, then you do your home visits at lunchtime, and then you do another 16 to 18 patients in the afternoon. And approximately, in my estimation, about 30% of all consultations that I do have a significant mental health aspect to them. So obviously assessing when somebody comes in and sits down in front of you, and when they say that they're struggling with anxiety, they're struggling with depression or any other mental illness, or they say that they're feeling acutely suicidal, trying to manage and do a proper assessment of that consultation in 10 minutes is absolutely impossible. And I think this is why there's a significant part of why people often get put onto medication comes down to the fact that GPs don't have the time to spend talking to people. So it's a quick and easy option to say, okay, well, let's put you on some medication, out you go, we'll see you in a month, and the whole thing kind of continues in that way. And obviously standard treatments for mental health, mental illnesses include medication, so antidepressant and anti-anxiety medication, and or referral into psychological therapy. Now, if I referred somebody today into psychological therapy, they would actually probably start seeing somebody face to face in about 6 to 9 months' time from a referral that is made today. So it's appalling the length of time that people wait. So in my experience now, and obviously that's considerable, I've probably dealt with thousands of patients over 11.5 years with mental illnesses, and the common theme is that people either don't improve or they do improve, but they never quite get back to their full potential once they've had problems with anxiety or depression, even despite interventions with medication and with psychological therapy. So I wanted to understand why this is happening in order so that I can best help my patients to get better. So I've spent quite a long time now looking into this in more detail. This is really interesting, this chap called Thomas Insell. He's a psychiatrist, and he was the leader of the National Institute of Mental Health in America for 13 years until 2015. And what Thomas says is that whatever we've been doing for 5 decades, it isn't working. All the ways in which we've approached these illnesses, the outcomes we've got to this point are pretty bleak. So this is, over the last 50 years. And this really, I think, is fundamentally important. We've spent so much time diagnosing mental disorders that we actually believe that they are real, but there's no reality. They are just constructs. Now that for me is mind-blowing. And I need to be very, very clear here and make a very clear distinction for what Thomas is saying. Thomas is saying that the symptoms that people have are very real. The symptoms of anxiety and the symptoms that people have with depression, but it's the actual, the construct, the diagnosis, the label of depression in itself. So effectively you get a bunch of guys who sit around a table and they say, in order to meet the criteria for depression, you have to have, meet all of these points. But really that's a human construct. They've made that disease entity up and said that basically in order to meet this made up disease entity, you have to have all of these symptoms. So we are not in any way saying that the symptoms themselves are not real. It's just that having a label, I've got depression, I've got anxiety, I've got, OCD, really what you have is you have symptoms but you don't, it's a construct, it's a human made up entity behind having a label and having a diagnosis, which is a completely different way of looking at things. And when people come in to see me, I've got X, I've got Y, what they're really saying is they're having problems with various symptoms rather than having the entity of a disease. It's like someone coming in and saying, I've got tonsillitis. Well, you haven't, you've got a sore throat. And once I've examined you, I might confirm that you've got tonsillitis, but there's a difference between having a sore throat and having tonsillitis. I'd like to talk a little bit now about the science behind the stress response. So this is going to take a few minutes, and I've tried to keep this as simple as I can. But for anybody who's interested, this book by Sapolsky, Why Zebras Don't Get Ulcers, is an absolutely fantastic read. It is quite detailed, so it's not it's not a light read before bed. It's very scientific. Question: the human body is designed to be in a stress response, or a fight or flight, as it's commonly known, in that mode. How often and how long do people think that the human body is designed to be in a state of stress and fight or flight?
Well, it's a temporary thing, it's not.
Yeah. So what? How long and how often?
5%. About 10 minutes a day.
More than that.
Okay.
An hour a day.
Right. So the answer is 20 to 30 minutes every 1 to 3 days. Okay. That's what over evolutionary terms. That's what we should be subjecting ourselves to, and it is for genuinely life-threatening emergencies that stress response kicks in. And obviously, in evolutionary terms, this was for situations like when humans were going to be eaten, and this obviously doesn't tend to happen very much these days, unless you're in Preston on a Friday or Saturday night. So we are not meant to be activating this chronic stress response for 6, 10, 14 hours a day. This is supposed to be a very, very short-term phenomenon. But increasingly, with the changes in society, people can literally spend every minute of their waking day in a stress response situation. Is anybody familiar with the concept of allostatic load? Has anybody ever heard of that term before? No. It's really very interesting. If you this top line here, if you imagine that top line to represent a peaceful state of calm, present mental well-being, and then what tends to happen is that you have a life event which knocks you down, and then you recover, but you don't recover to the initial level that you were at to start with, and then another life event, and then another life event, and so the red line represents the physiological and the psychological burden that you are subject to over time, and that red line is known as the allostatic load, and this is the load that people carry with them on a day-to-day basis. I've tried to keep this as simple as I possibly can, but I think it's really important to have an outline of what's going on within the body. So there's an axis which is known as the HPA Axis, which is the hypothalamus, which is in the brain, a pituitary gland, which is in the brain, and then the adrenal gland, which just sits on the top of the kidneys. And chronic stress activates this HPA axis, okay? So the consequence of chronic stress has positive factors and negative factors. So it makes things increase and it makes things decrease. And we can all relate to this, I'm sure. Obviously, the first thing that changes is when you're under chronic stress, your heart rate and your blood pressure are going to go up. And that is because of the action of adrenaline and noradrenaline. Other changes that happen is you get the release of cortisol, which is steroid within the body. You get an increase in glucose production within the body, and it causes an increased inflammatory response. So musculoskeletal problems, chronic neck pain, chronic back pain can come from inflammatory response. Obviously problems with glucose, type 2 diabetes can be a problem, so chronic stress is associated with type 2 diabetes. And when the body is under threat, obviously all of your normal day-to-day functions are not required. So your body channels energy into the things that are needed in order to escape the situation, and it shuts down bodily functions that are not important in that moment. And those things that shut down include growth and maintenance, your immune system. It doesn't matter if your immune system kicks in if you're going to be eaten or or you're going to die as a result of trauma. Reproduction. So people with anxiety, depression can have lack of libido, and men can struggle with erectile dysfunction and digestive problems, so things like irritable bowel syndrome. So you can see that the more stress that somebody is subject to, with the chronic activation of these, of this axis, resulting in these biochemical changes, goes on to then cause significant physical health problems as well. So chronic activation of that HPA axis causes biochemical dysregulation, which results in a drop in serotonin levels. Okay? Antidepressants are SSRIs, which is selective serotonin reuptake inhibitors, and what that means is it basically increases your serotonin level. So when you have this axis resulting in a drop in serotonin level, you take an antidepressant, which then increases your serotonin level. Okay? This is the analogy that I use with my patients, and I think it's really powerful. If we had a leak coming through the middle of this ceiling in here right now, and we put a bucket of water, a bucket underneath the leak, the bucket serves a purpose because it stops the leak destroying the room. Okay? But no matter how big your bucket is, it is never going to stop the leak at the source of where the leak is coming from. Okay? And this is exactly what is happening with antidepressant medication. So your medication is treating the effect, it's treating the consequence, but it is not treating the cause. The cause is chronic mental stress. The effect is biochemical dysregulation, and you're simply giving a tablet to correct the effect of the biochemical dysregulation, but you are not stopping the leak at its source. Does that make sense? Yeah? So no matter, if you only rely on medication to solve the problem, you are not ever getting to the cause of the problem, so you're not understanding the cause and effect pathway. So very briefly, some of the medical conditions that you can get from chronic activation of that HPA axis, so high blood pressure, heart rhythm abnormalities, atrial fibrillation, type 2 diabetes, osteoarthritis. Most people think that osteoarthritis is due to wear and tear, but in fact, there's increasing evidence now to show that chronic activation and stress and depression can cause musculoskeletal problems. And that's why you can have marathon runners who are in their 60s, 70s and 80s who are absolutely fine, and people who have never done hardly any exercise or any manual labour struggling with, with musculoskeletal symptoms. Autoimmune diseases, so type 1 diabetes, celiac disease, rheumatoid arthritis because of the chronic inflammation, obesity, and increased risk of substance misuse as well. So the body is a very cleverly engineered system, and the concept of homeostasis is that the body always tries to keep itself regulated and in balance all of the time. And when you think, if you've got gastroenteritis, you've got diarrhea, you've got vomiting, and you feel awful because you're throwing up and you've got diarrhea, there is a purpose behind the body having that kind of a reaction. It's your body's way of trying to get itself back into balance, into homeostasis. So although you feel awful at the time, it's a beneficial thing for you to go through in order for the body to get itself corrected. Anxiety and depression is a coping mechanism due to the overstimulation of the fight or flight response. So if you chronically expose yourself to all of the, to the glucose and the cortisol and the inflammatory markers, your body's way of trying to deal with that overstimulation is to try to shut it down, to try to shut itself down. So it's like a fuse, in an attempt to get things back to normal. It just shuts the system down, and in that same way, your body would say, I've got no energy. I don't want to do anything today. I want to take to bed. It makes you feel numb. It gives you that brain fog. It's trying to get you back towards equilibrium. So in that respect, anxiety and depression are therefore helpful symptoms. It's your body's way of alerting you to the fact that there is a problem. But nobody sees it from this perspective. People will come in and they'll be worried about the symptoms rather than acknowledging that the symptoms are there to serve a purpose.
Can I just ask, so from what you've just said, would an anti-inflammatory diet benefit people with mental health conditions?
Yeah, I think it would. Yeah, absolutely. If depending on, obviously there can be multifactorial, but yeah, I think it would help. Yeah. So where does chronic stress come from? So as we've already discussed, chronic stress activates the HPA axis. So basically, at any point in your day, when you are not in a calm, quiet peace of mind, then effectively your body is under stress. So if I said to you, what percentage of your day are you calm and quiet in terms of your physiology versus, dashing about trying to get things done and, the adrenaline's going. So chronic stress can come from a few places. It can come from thinking about the past or thinking about the future. So lots of people, common aspects on this is guilt and judging yourself from things that have happened in the past, resentment and hurt, grief and loss is a common factor. And then worries about the future as well, the what ifs, so worry and over-analysis. And this concept is that if you think about something and you can't come up with an answer within 2 to 3 minutes, then the longer you spend thinking about it, the less likely you are to come up with a solution to it. You're better off walking away, doing something else. And when you try to remember something, and when do you remember it? It's normally when you're in the shower or you're doing something unrelated, and your mind's calm and you're not over-analysing. And those factors commonly then kick in, activate the HPA axis, and then you're into that pathway. Anybody familiar with what epigenetics is? No, this is new. This is really the latest information, really. And this is that it is changes to the expression of your genes, but not changes to the genetic code itself. Okay? So the Human Genome Project has identified that every human being has approximately 20,000 genes in their body. And if you think of a huge warehouse that's got 20,000 light bulbs in the ceiling, at any one time, 5,000 of those light bulbs are switched on. And this is the same for every one of us in this room right now. You've got about 25% of your genes are activated and 3/4 of your genes are not activated. Trauma and poison cause biochemical dysregulation. Everybody would appreciate that. But what we're now starting to understand is that thought can also cause biochemical dysregulation, and that biochemical dysregulation can then go on to change the expression of your genes in your body. And this understanding is fundamental to see why physical health problems can come about as a result of problems that originate in thought. Does that make sense?
It does, yeah.
Yeah? So that's the end of the science. So just a little bit about mental health coaching. So I think it's really important to understand how the body works, and when you understand something, you don't need to be frightened by it. And like I said before with Thomas Insell, when he was talking about the anxiety and depression and mental illnesses being constructs, he is not in any way suggesting that these symptoms are not real. These symptoms are incredibly real, but I think it's helpful if we stop thinking about them as diseases and just try and understand the symptoms and where the symptoms come from, rather than just saying, I've got this and I've got that diagnosis. So as a mental health coach, I guide people to understand where the symptoms are coming from, the source or the cause of their symptoms. And so when I see people, both in my clinic and with the coaching, I say to people, where do you feel like your symptoms are coming from? Where are your feelings coming from? So if this is a person who is struggling with stress, anxiety and depression, what factors do you think people would commonly say are causes of them feeling stressed, anxious or depressed? Work, absolutely. Sorry? Family, money, yeah. Health, absolutely, yeah. Okay, so this is not exhaustive, but this is, you know, I came up with 8. So family, work, money, chronic illnesses, bereavement, moving house, unemployment, and, you know, relationship difficulties. So this is the person in the middle, and all of these factors are effectively outside of that person themselves. They're external factors to them. So where does my experience come from? So most people will say, I feel what I feel due to outside factors making me feel this, as we've just seen, all of those 8 factors. This is why I feel what I feel, because of these external factors. So the direction of their experience is that it's coming from external factors on the outside to making them feel what they feel on the inside.
Do you ever get anybody who just has no clue of why they feel like that?
Yes. Yeah, absolutely. You know, people will say, you know, that they have, you know, they have a good life, they've got a great family, they've got nice kids, good job, but they still feel the way they feel. But that situation will be answered shortly. Okay. So obviously you can get the fact that what I'm saying here is that your experience doesn't come from all of those outside factors. That's what most people commonly believe. But is that actually true? So where do your feelings actually come from? Anybody got any thoughts? What's here? What's the missing link?
Emotions.
Thoughts.
Brain.
Thoughts. Yeah. So emotions is a feeling. Okay. So it's thoughts. Was that you who said thoughts? Yeah. So your thoughts create your feelings. And a really helpful way of thinking about this is a coin. If you think about a coin, on one side of the coin you have heads, and on the other side of the coin you've got tails. Okay? Now, you can't have heads without having tails on the other side of the coin. They exist together. And it's exactly the same with your thoughts and your feelings. It is not possible for you to feel anything in your body without thinking it first. And equally, so that they are 2 sides of the same coin. Okay? And this is true for all people 100% of the time. Whenever you feel bad because you're having bad quality thoughts. Whenever you feel good and positive and optimistic, you feel that because you're having good, optimistic thinking. So you are feeling your thinking 100% of the time. As a result of your feelings, it then drives behaviours. Okay? So when people feel bad, if they feel angry or agitated, down, depressed, they try to do behaviours to make themselves feel better. And some of those behaviours can be seen as positive. So it could be, you know, they'll go and do a 5 mile, a 10 mile run, they'll go and do exercise, Or, more commonly, people would go and take drugs, alcohol, spend money they haven't got, you know, prostitutes, whatever. So people's behaviour is a result of them trying to satisfy discontent with their feelings. But, as you can see, with this chain, if you're trying to change things at these levels, you are not dealing with the fundamental cause of where your experience is actually coming from. Okay? So we are living in the feeling of our thinking, not in the feeling of our circumstances. So it doesn't matter what's going on around you. What matters is what you're thinking about what's going on around you.
Glass is half full, glass is half empty.
Exactly. So it's not your work, it's not your family, it's not your money, it's not your partner. It's what you think about your work, your family, your money, or your partner that is making you feel what you feel. Because if everything that controlled how you felt was outside of you, that would mean you would have to try to change the world around you in order for you to feel better. And that's not possible. How easy is it for you to try to change somebody else? How easy is it for you to control things that you can't control? We don't have control in the world. Most humans like to think that they've got control, but the amount of control that we actually have is fairly small overall. So when you see things from this perspective, that we're feeling our thinking, it gives you the power, because when you understand how thought works, it changes your relationship with your experience. Okay? I'm going to go and explain this in a bit more detail now. So the more we understand where the experience is coming from through thought, the less frightened we need to be of that experience. So, understanding thought and how thought works. The brain is like a bubble machine. So if you've got an electronic bubble machine that you plug in, put some fairy liquid in it, and all day long it will kick out bubbles of different shapes, different sizes. Some of them will pop immediately when they come out of the machine. Some of them will drift across the room and pop when they touch the wall or the ceiling. Thought is constantly being produced. It's energy, it's how the brain works. We can't, so some bubbles are big, some are small, some pop immediately. This is fundamental. Thoughts are like bubbles. They are transient, so they come and go. There is no one thought that will ever come and not go. Thought is always transient. It has to be transient. And when you understand that, it's like in a train station, for example, if you're in a busy train station, a train will come into the platform, it will then leave, and it'll be replaced by a new train. And thought works exactly the same way, is that you don't have to do anything to that thought. You just have to know that thought is transient. It will disappear, and it will be replaced by a new thought shortly afterwards. No thought is inherently positive or negative. So a thought is just a thought, but it becomes positive or negative depending on the energy and the attachment that you give to that thought once it comes into your consciousness. This is a massive point. That no human being can ever control their thoughts. We've got no control whatsoever over what thoughts come into our head at any time. You know, if I said to you, what are you going to be thinking about in 5 minutes' time? You've no idea. You can't choose the things that come into your mind at all. But you can control how much energy you give to that thought once it comes into your mind. And the more energy you give to that thought, the more real it looks, and the more real it looks, the more you believe that it's true. Okay, so if we imagine a balloon, if you're holding a flaccid balloon, it takes up hardly any space at all. And the more you blow into that balloon, and the bigger and bigger and bigger the balloon gets. And as the balloon gets bigger and bigger, it looks more real. And if you hold that balloon to your face and you know it covers your eyes and you can't see, then you believe that that balloon is real, but it's real because you're blowing energy into it. You're making it look real by driving energy into that. Okay? And because thought is transient, when you know that thoughts will pass because they always do, you don't have to do anything with that unpleasant thought. You just have to know by understanding thought that that thought will pass. It might take a few minutes, it might take a bit longer, but it will always pass. So what is true for all human beings? So I don't think any human being will disagree with the principle of gravity. It's a fundamental truth. It's true for all people all of the time. So I think there are three factors that have to come together in order for a human being to experience something. The first is that I think it's always slightly controversial, this one, but I think everybody can appreciate that there is an energy behind everything that goes on in our universe. We're not in control. The universe has been around for 13.8 billion years and none of us are responsible for it. There's an energy that, that drives things to be the way they are. I'm standing here, my heart is beating. What is causing my heart to beat? You know, there is an energy to the universe. What makes an acorn become an oak tree, you know, and babies grow? You know, plants always grow towards the sun. There is an energy in the world, in the universe. Some people might call that God, some people might call it spirit, some people might call it universal mind, but there is an energy. Everything needs a power source, effectively. You need to be conscious, and you are conscious through your awareness, through the five senses, and thought. Okay? So the interplay between each of those three factors dictates what we experience. So if you didn't have a power supply, you wouldn't experience anything. If you were unconscious on a ventilator, you wouldn't experience anything. And if you didn't think, you wouldn't experience anything because you wouldn't be able to interpret things around you. The projector metaphor. So just using that concept of those the three principles, the universal energy is the power supply to the projector, which we found eventually. The thought is the film that is being played through the projector, and the consciousness is the bulb that illuminates the film, or the screen that brings the film to life. And effectively, we are in the film, we are the lead actor, we are the director, we are the special effects person, and we are the person sat in the cinema watching all of this. Okay? So our thoughts are creating our reality. Our thoughts are brought to life through consciousness. So to summarize, and obviously I've had to keep this very funneled down, you know, for the purposes of time, but everybody does their best with the level of understanding that they have. Okay? And when you change your understanding of how the situation works, then everything changes in front of you. So medication is not a solution, although it is helpful, it serves a purpose, and I would never recommend that anybody you know, just stops medication. I've prescribed every mental health medication that there is, and I do believe that it is helpful, but it is not a solution in and of itself. And in my opinion, I think techniques that rely on changing your thoughts, so positive psychology, oh, just think positive. Well, we now know that you can't think positive because you can't control what you think about. And then when you get into the more the therapy-based things like cognitive behavioral therapy or neurolinguistic programming, these are attempting to manipulate the thought in and of itself. But when you understand thought and you know that thoughts pass and they have no power over you if you don't give them power, if you don't drive energy into them, then they have no power over you. So your thoughts create your feelings, and this is how human experience work. And we live in the feeling of our thinking moment to moment. So in conclusion, there is one cause of all mental illness, and that cause is chronic mental stress. Chronic mental stress causes psychological and many, many physical symptoms, and I think as time goes on, the implications for the physical symptoms is going to get more and more as well. Understanding where your experience comes from gives you control over your feelings rather than you being controlled by your feelings. We live in the feeling of our thinking 100% of the time. So in terms of what I do as a mental health coach, so I help individuals on a one-to-one basis struggling with stress, anxiety, depression, or any other mental illness. I work with businesses to reduce long-term employee absenteeism due to mental ill health, and I can do face-to-face sessions or online consultations through Skype or Zoom. And that's the end of my talk today. Any questions or? Thank you.
Let me ask you one. I understand this, I get it, but in the real world,